Doc, thanks. Los Angeles County, the most populous in the country, going back to mandating masks for everyone indoors, vaccinated or not. Right thing to do or no?
Well, look, I think in places where you have dense spread, it's prudent to take public health precautions. I think the bottom line is most places are unlikely to do that. I think Los Angeles is likely to be the exception here. And most of the spread that we're going to see over the next couple of months is going to be against the backdrop of no public health precautions, or very limited precautions. So I think individuals in these hotspots around the country who are vulnerable are going to have to take measures into their own hands and take precautions if they think that they're at risk, because a lot of the spread is happening in states that have already affirmed that they're not going to go back to mandates. They're not going to go back to mask mandates or any kind of ordinances shutting down businesses where spread might be occurring. So this is likely to spread unabated. And really, the only wall is going to be a wall of immunity that we get through vaccination or through the natural immunity acquired through continued spread.
We continue to hear from people, some people who are hesitant say, look, I want complete approval from the FDA. When they approve this, not special authorization, when they approve it, maybe I'll get the vaccine. Is the FDA making a mistake by moving slowly on that?
Well, look, I'm not sure the FDA is moving slowly. My prediction always was that it would take the FDA about 3 months from the time that the applications were submitted to the agency to issue a full approval. Pfizer submitted its application the end of May. Moderna submitted it in early June. So we're coming up on about 3 months as we enter into the end of August. So I think that time frame is still likely to hold. I think you're likely to see the FDA approve these vaccines somewhere around that 3-month threshold. That was always my assumption based on just understanding the FDA process.
The FDA said today that vaccines for kids under 12 expected like early to midwinter. That's a long way out. Are you worried about the threat to kids between now and then, especially in school?
Well, look, the best protection we can afford kids is by controlling the spread of the infection in adults. What we've seen in other countries is that when the rate of infection goes down in the adult population, the rate of infection goes down in the children as well. So if we can control the infection in the adult population, children are going to be less vulnerable. The vaccine for children under the age of 12, so the vaccine being formulated for children ages 5 through 11, is a different vaccine insofar as it's a different dose. So the dose that the adults are using and the dose that are being used in children above the age of 12 is a 30 microgram dose, at least with respect to the Pfizer vaccine. The vaccine that Pfizer is formulating for children ages 5 through 11 is a 10 microgram dose. So that's going to go through a separate evaluation process by the FDA. FDA typically views children 12 and above as little adults, and they'll look at the data in the adult population and use that as a barometer for how it's likely to perform in children. Below the age of 12, FDA does view the biology differently, and they'll put those vaccines through a different kind of evaluation process.
Finally, the CDC said today, yes, we're considering booster shots for immunocompromised patients. It was just 1 week ago that the same CDC told us it was too early to start talking about boosters for anybody. The messaging here, it's frankly, it's been quite inconsistent. Is it concerning?
Well, look, I think the bottom line is that we're going to be boosting some portion of the population. Certainly anyone who gets a vaccine right now, that vaccine is going to protect them through the fall and the winter. Anyone who got a vaccine really over the summertime, most people got vaccines in April and May. That was when the bulk of the population got vaccinated. Those vaccines are likely to be durable through the fall season as well and into the winter, especially considering that many of those individuals were younger individuals who are going to get a more robust response from the vaccine itself. But we've vaccinated the 1.34 million residents of nursing homes back in December, and we vaccinated most of the population under the age of 65 in January. So our most vulnerable citizens were vaccinated very early. And what we're seeing in the data coming out of Israel is that the durability of the vaccines isn't as long as we might have predicted at the outset. You do see some decline in durability over time, particularly among older individuals. So I think considering boosters, especially in that older, more vulnerable population, is something that we're going to have to do. Other countries have already announced that they're doing that. Israel has, France has, the UK has announced that they're going to be boosting their population above the age of 70 and then bringing it down, walking it down to younger ages as well. So I think we're going to get there in terms of looking at boosters, particularly for that older population that was vaccinated back in December and January. Yeah. And it could be that you get a very durable response once you get that third dose.
One more question before we go. My father's 93. He lives in Mississippi, and the health professionals down there just warned everybody who's older, wear a mask all the time when in crowded places. Is that sort of thing coming to other areas, or is that specific to areas like theirs where vaccination rates are low?
Look, some parts of the country, I'm in Connecticut right now, well over 60% of the population has been vaccinated. You've had a lot of prior spread, so there's a lot of immunity in the population. I think you're likely to see very low infection levels, even with the Delta variant in parts of the country where you've already seen a lot of spread and vaccination rates are very high. But in parts of the country where vaccination rates are low and you haven't seen a lot of prior spread, so there's not a lot of immunity in the population, this Delta variant could spread quite rapidly. And, we're going to see further spread. We haven't seen the worst of the spread of this Delta variant yet. I think if you're in those parts of the country and you're vulnerable, you need to take precautions because you're not going to see local officials implementing public health precautions against a backdrop where vaccines are available. A lot of people have had the infection. A lot of people have had the opportunity to get vaccinated. So I think that's going to make public health officials and local officials more reluctant to implement the kinds of measures that you're seeing Los Angeles take right now.
Dr. Scott Gottlieb, always great to hear from you. Thanks so much.
Shepard Smith here. Thanks for watching CNBC on YouTube.